And joining us now, we have Governor Andrew Cuomo of New York. Governor Cuomo, thank you very much for being on this morning. We see some of the challenges through the pictures that are coming out of bodies and trying to figure out how to accommodate them, the requests for body bags that we're hearing from all over the place. What would you say, as we're looking straight down the barrel of the height of this, is the biggest challenge right now?
Good morning. Good to be with you, Mika. Look, this is a horrendous situation, right? I lived through 9/11 in New York. The country lived through 9/11. I thought that was going to be the tragedy of my lifetime. And this turns out we've lost a multiple of people here. So it is horrendous. What people have to understand is, yes, you're going to see a quote-unquote flattening of the curve, right? Fewer new hospitalizations, which is a function of what we are doing, Mika. None of this is preordained. I will tell you the infection rate in 2 days if you tell me what the behavior of people is today. So our compliance has worked. Our close down has worked. That has dropped the number of new hospitalizations. And we hope that continues, and our behavior will determine that. The horrendous news is the number of deaths goes up because these are people who were hospitalized 2 weeks ago, who weren't treated successfully, who wound up on a ventilator. The longer you're on a ventilator, the worse it is, and they're now passing. So you'll see the death toll going up. At the same time, the hospitalization rate of new people is going down.
So, Governor Cuomo, I'll say it so you don't have to. When we listen to the president's daily briefing, we have to work really hard to separate fact from fiction. One thing he often talks about is opening up the country. There's this May 1st date being tossed around. I'll say it so you don't have to. Not possible. Not scientifically possible. There will be a resurgence. There's not testing available widespread enough to contain this. And most scientists will say that we're looking down the barrel of 18 months. I ask you, how, with what Americans are being asked to do, with what New Yorkers are being asked to do, how can this country sustain this economically and emotionally?
Wow, that's a good question. That's the question. You do what you have to do, Mika, right? We're all living this. We're all trying to rationalize it. Good news is I have two of my daughters who are with me, and we talk about this every night. I try to put it in an historic perspective. Yes, this is going to be the challenge of, I hope, their lifetime. I hope my lifetime. I don't want to go through this again. But generations have gone through worse, right? You look at past world wars, you look at Vietnam, World War II, what people endured. But this is going to be a horrendous transformational period for us. In terms of when we get back, I don't think we ever get back to normal. I think this is one of the new normals now in public health, like we go through the environment, like we've gone through the economy. It's a new normal. And it's going to depend on what we do. That's why this is such an important period for government and a political discussion. Nothing is pre-charted here. It's all a function of what we do. How good are we at getting this testing up? Are we better than we've been in the past? Is it going to take us months to come to scale on rapid testing? That's the only way to start to get people back to work. You have to have millions and millions of tests, frankly, faster and better than we have done to date. Yep. How are we prepared in the future? If we're not expecting a second wave or a mutation of this virus, then we have learned nothing. And as Congressman Suozzi said, what does the federal government do and what do they pass? And if they pass another piece of legislation through that Senate that is politically biased, that is trying to help Republican states and not taking into consideration where the impact really is, like in New York and California and Michigan, then shame on all of them. So it is purely a function of what we do and how well we do it.
Governor Cuomo, it's Willie Geist. Good to have you on this morning. As you just mentioned, the $2.2 trillion stimulus package passed through Congress, presumably to help places like New York City and New York State, the epicenter of the crisis. You seem to have just suggested, though, that Republicans in the Senate are more interested in helping red states and than blue states. What did you mean by that?
Yeah, when you look at the package and you look at the distribution, the Senate almost treats it as a pork barrel bill, Willie. I was in the federal government for 8 years. I was Secretary of HUD. I know how the federal government works, and I get the normal politics that representatives want to take care of their district, their state. I get it. But that's not what this is. You know the states and the cities where you've had a higher level of the stress. You can look at that map. You see where the cases are. You see the infection rate. This was not supposed to be grab bag politics. Everybody take care of their home state. This was supposed to be help the places that had the greatest pain, where you have the most cases, where you had the most cost. The bill that they passed shorted New York State, which on any analysis has more cases, more costs, more infection, more devastation, and more loss. And the only discussion is, well, politically on the Senate, this is what we needed to do. I'm tired of that, and so are the American people, by the way. This is no place to play politics. The country's done with it. Not at this time, not in this place. And what that federal government does through legislation, through executive action, with testing and startup rules, that's going to make all the difference. That's going to make all the difference for all of us long term.
So, Governor, you've said a couple of weeks ago you don't like playing catch up, and unfortunately that's what you and other governors across the country have had to do to try to rebound from a slow start here. Dr. Thomas Frieden, who was the New York City Health Commissioner for many years and later ran the CDC under the Obama administration, he said that if New York State had started all these measures that we have now a couple of weeks earlier, the cases would be between 50 and 80% lower than we're seeing right now. I know you didn't have all the information you have today 2 months ago, but in hindsight, do you wish we had started earlier in the state of New York with basically shutting down the state?
Yeah, look, if what that leaves out is would people have followed the policies, right? All the projection models are wrong here, Willie, all of them. We had a projection model from McKinsey that said 110,000 beds we would need. We had Columbia University saying 170,000 beds. All the projection models were wrong because the variable was, do you do close down, and do people listen to the close down? And that's the question. You know, I can say, okay, everything is closed down. And people say, that's nice, you're being overdramatic, you're political, I don't believe it, I don't think it's necessary, I'm not going to comply with it. So it's not as easy as saying, from a scientist's point of view, well, you just declare it and it will be so, right? You left it to the states. We're not dictators. You need the body politic to believe you're correct.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.